Okay, so now we're going to go over a rehab component to treating lateral epicondylitis or tennis elbow. So what we're going to use is an exercise where the patient is going to be lying on their side, and we're going to put them in a position where we can activate the serratus anterior in a way that it's used in function. So a lot of people are going to treat serratus anterior inhibition with a push-up plus, or dumbbell bench press, where you're protracting the scapula. And yes, we know that it's an upward rotator and it protracts the scapula at 120 degrees of shoulder flexion, but it doesn't really do that in function. What it does in function is it activates or stabilizes the scapula and holds it flush against the rib cage. So we know that the serratus anterior is going to have a superior and an inferior portion to it. It will attach along the medial border of the scapula, and then it actually wraps underneath the scapula, and then we'll go around and attach on ribs 2 through 9 along here. So it's going to control rib motion quite a bit, but then it's also going to be anchored by the abdominal wall and the diaphragm so that it can sufficiently stabilize the scapula. When we get scapular instability in an athlete, then that's going to cause hyperactivity of a lot of the muscles down the chain, which you might get elbow movement dysfunction here that might cause hyperactivity of that lateral epicondyle that we talked about. So one of the treatment tools that you have to use is you have to do an activation exercise to address the instability or the dysfunction that has resulted in the pathology that walks in the door. So in this position, they're going to be laying on their side, and they're going to be laying on their shoulder. Now they're passive in this position, just laying here. And what we're going to do is we're going to have the athlete, actually they're going to load this elbow a little bit, just lightly, and you can already see, if he loads his elbow, you can see activity in here. So we've got lower trap here and the rhomboids and serratus anterior this way. So if he relaxes, what we're going to do is we're going to activate the serratus anterior in such a way that it actually affixes the scapula to the thoracic spine. So if we get him to lightly load the elbow here, and then we have him lengthen and tuck his neck to a neutral position. We don't want to go excessively back. We obviously don't want him in an extended position, but we want him to have a neutral position here, neutral spine here, and then from here, he's just going to lightly elevate his rib cage just a little bit. And by bringing that up, by uprighting his spine, using the fixed point of the elbow here, we're actually activating the serratus anterior and training it and getting it to activate and load the scapula flush against the rib cage here. So in this position, we are now turning the serratus anterior on in a way that he actually uses in function when he's playing tennis or baseball or picking up a cup of coffee or whatever. This is what the serratus anterior should do. So in this position, we can have him roll forwards a little bit. We can have him roll backwards, right, to activate and challenge the activity of the serratus anterior, to challenge the scapular stability. We can also activate one of the abdominal oblique slings that anchors the serratus anterior. So on the downside, he has the serratus anterior here, which will interdigitate with the internal oblique and the transverse abdominis and the diaphragm. But then they will wrap around and actually interdigitate with the external oblique on the opposite side. So this upside, this left hip, is actually contributing to stability of this shoulder. So if I get in here and I actually pull this hip back and I have him resist me, don't let me move, you can see automatically we get better activity right here. So by activating the anterior oblique sling here, we're getting better activity of the serratus anterior here, and we're treating the whole chain. So this is a very, very powerful exercise in the clinic. It's also an easy exercise to send them home with. They can hold here, upright, and then they can perform diaphragmatic breathing to, again, activate the diaphragm and the abdominal wall that anchors this. Or you can have them hold that position and lightly oscillate forwards and backwards. But that's a great day one exercise that activates the serratus anterior and the other scapular stabilizers in a way that incorporates the entire system and not just the serratus anterior with like a push-up plus. Okay? Super.